Hey, this is Rick Casalge, injury specialist from exercisesforinjuries.com. In today's video, what I want to go through is a few safe knee strengthening exercises for a meniscus tear. So Jenna's going to go through them. I'll kind of highlight the details, and Jenna's going to start off with the first exercise, which is flexion extension. Okay, good. So kind of breaking it down, you're in a standing position, you have the hand up against the wall, you're going to place your weight onto one leg, and then you're going to swing the leg back, and then swing the leg forward, swing it back, and swing it forward. Perfect. Now looking at the sets, reps, time, and intensity for that exercise, sets are 1, repetitions will be 5 each direction. Time, smooth controlled movement with a good contraction at the end of each of the movements. Looking at the intensity is light. We're really targeting a lot of the hip and also isometrically contracting the muscles around the knee. Now the purpose of this exercise is twofold. When you're standing on that leg, we're isometrically working the muscles around the knee and in the hip. Also, when that injured knee, when we're swinging the leg forward and back, we're working the muscles around the hip. So when we have a knee injury, it's really important to make sure that we have good, strong hips. That'll help when it relates to recovery from the meniscus tear, and also help when it relates to subsiding pain and preventing a future injury. Now moving on to the second exercise, this is heel slides with band. Good. So you're sitting down, you have the loop tubing wrapped underneath the arches of your feet. So you're sitting nice and upright, you're going to straighten the legs out. Good. You're going to bring them back, and then you're going to straighten them out again. Perfect. And back. Now if going 2 legs is too challenging, you can do the exercise 1 leg at a time. Perfect. Good. So looking at the sets, reps, time, and intensity, sets are 1, repetitions I start off with 5, progressing on to 10, time, smooth controlled movement with a good contraction at the end position, specifically the muscles around the knee. And looking at the intensity is light with this one because we're mainly working on activating endurance and strength, the muscles around the knee. Now the purpose of this exercise is twofold: to work on the range of motion in the knee when it relates to flexion and extension, also to work on the activation, endurance, and strength on those muscles around the knee, and utilizing the resistive tubing that increases the challenge of the exercise. Now moving on to the third exercise. Good. Hip abduction. So with this one, very similar to the first exercise, you're standing nice and upright. We have the hand up against the wall to remove balance so we can focus on isolating the exercise and working on the muscles that we need to. So Jenna's going to stand on one leg, then bring the leg out to the side and then back. Usually you're going to bring the leg out to the side 30 degrees to 45 degrees. It depends on how flexible you are, because we're looking at minimal movement in the hip. We're going to get some movement. We don't want excessive movement in the hip. And with this exercise, we're really focusing most on the muscles in the outer part of the hip. Perfect. Now looking at the sets, reps, time, and intensity for this one, sets are 1, repetitions would be 5, on each side. I wouldn't alternate back and forth, but 5 on one side, 5 on the other. Looking at the time, smooth controlled movement with a good contraction at the end position. And the intensity with this, it is light. Now the purpose of this exercise is twofold. 1, strengthening the outer part of the hip. So with the part of the exercise where you're bringing the leg out to the side, if that's the injured knee, then we're working on strengthening the outer part of the hip. So as I've mentioned before, strong hips are important for prevention of knee pain and recovery of knee pain or knee injury. Now the second benefit or purpose of this exercise is if the injured leg is the leg that you're standing on, with that one we're isometrically contracting and strengthening the muscles around the knee and the hip as well. So it's sort of the injured leg's working the whole time, and we're kind of targeting the most important muscles to help when it comes to recovering from that meniscus tear. Okay, we're down. We got 3 that are down. Now moving on to the 4th one. Okay, good. So this is static quad contraction. So you're lying down, so you're sitting, and what you're going to do is contract the quads, and that's going to straighten out the leg more. Then you're going to relax, and then you're going to contract again. That presses it down, works on end range extension, and then relax again. And maybe I'll get you to face this way. And again. Good. And relax. Good. Now looking at this one, sets, reps, time, and intensity. Sets are 1. Repetitions would be 5. Time. This is a nice smooth contraction, holding that contraction for about a second at the end of the movement or end of the exercise. The intensity for this one is light. This is more of activation, endurance, and strength of specifically the quadricep. And the purpose of this exercise is really to train that muscle, the quadricep muscle, which might not be working properly after the meniscus tear. Train the quadricep muscle to turn on when it comes to activation, work on endurance and strength of that muscle, which is important. Okay, so that's now moving on to the 5th and final exercise. Good, so it ends up being a glute bridge. So looking at the starting position, you're lying on your back, arms are to the side, you're relaxed, you're going to bend the knees, the feet are about hip width apart, you're going to push through the heels, you're going to bring the hips up, knees, hips, and shoulders on a good straight line, then you're going to come back down, and then again coming back up. Good. Now looking at the sets, reps, time, and intensity for that one, sets are 1. Repetitions, I start off with 5, progress on to 10. The time, smooth controlled movement with a good contraction of the glutes, and then secondarily the hamstrings. The intensity for this one is light, and the purpose of this one, once again, as some of the other ones, we're really working on the muscles around the hip, specifically the glute and the hamstring, to help when it relates to recovery from an injury and prevent a future injury. So there you go. Give those safe knee strengthening exercises for a meniscus tear a go. Now, if you're suffering from knee pain and you want some of my other best tips and tricks when it relates to overcoming knee pain, then I recommend you click right here. I have a brand new free report called 5 Tips and Tricks That Fight Knee Pain and Tightness. Just click right here. Let me know where to send you that report, and I'll send you that report right away. Now, if you're watching this on a mobile device, tablet, or smartphone, head down below in the description and click the first link, which will be exercisesforinjuries.com/knees. Let me know where to send you that report, and I'll send you that report right away. Now, if you got benefit from this video, make sure to like this video. If you have a question or comment for me, leave it down below in the comments section. And lastly, hit subscribe to get future pain relieving videos.